if you don't know where to begin, better ask Win.
Winston, good to see you. Today we are talking through the three big medical costs that retirees often underestimate. So if you're retiring soon, you may want to budget more for healthcare than you were thinking. The Wall Street Journal recently wrote an article spotlighting three major medical costs that retirees tend to underestimate. The first is medications.
Wow, medications. It is incredible. I mean, we live relatively close to the Mexican border here in Phoenix. And I can't tell you how many people actually travel from Phoenix and Tucson down to Nogales, Mexico to buy their medications because you get the same exact medication for 20 cents on the dollar. And recently the Trump administration, targeted the big pharma and is trying to get these medicines and these pharmaceutical drugs to a much lower price point to be commensurate with the rest of the world. But doesn't seem like we've really seen much of that stick yet.
Mm-hmm. So next we have what the Wall Street Journal is calling medical isolation, higher costs in areas with limited healthcare access.
Right. Yeah, that's absolutely a fact. So, you have people that live in the big major metropolitan areas. Again, we'll use Phoenix here. Sometimes people want to retire and move out of Phoenix. They move up to Prescott. They move up to, parts of northern Arizona that are very remote. It might even be closer to Las Vegas than sometimes in the heart of Phoenix. And there's not as good of medical options in these remote areas. You have travel, you have higher drug costs, you have higher overall expenses than people that live in the big cities. It's kind of a supply and demand thing. Mm-hmm. And so that's something that when you decide to retire and get that retirement home outside of the big busy city, it might cost you more money.
Mm-hmm. And then last we have concierge care. In some areas with large affluent retiree populations, doctors are increasingly turning away patients on Medicare and accepting new patients only if they pay an annual fee for concierge medicine. And that fee averages $3,500 a year.
Yeah, if not more.
Right.
We do have a couple of clients that are MDs, medical doctors. And, basically Murray, one of the guys I'll mention, he told me, he said that we don't get paid. We see a patient that's on Medicare and we don't get paid for a month, 2 months, 3 months. They're waiting to get paid. And so in his particular situation, he decided to change his practice to that of a concierge practice where he has this list of clients that are good clients and he charges them a fee, probably a little bit more than $3,500 a year, frankly. And he is able to provide them top-notch personalized care. And so people need to weigh that out, right? If it's worth it to them or not. But that's where a lot of the medical field is going to. And if you were a doctor, you might want to do the same thing.
Mm-hmm. Becoming more and more common. All right. The bottom line for everyone, of course, is that healthcare and retirement isn't just about insurance. It's about planning.
That's right. You got to plan. And that's what we do. We help people plan. There's a fourth area that the New York Times article didn't really address. And it kind of falls under that medical arena. And it's long-term care planning.
Yeah, that too.
This is probably one of the single largest causes of bankruptcy in the senior world is the cost associated with long-term care. And they do kind of fall into the medical arena. We tell people there's three phases to retirement. There's the go-go years when you retire, the slow-go years when you get a bit older, and then there's the no-go years late in life. And those no-go years can be more expensive than any other part of your life. The solution to dealing with that is good planning.
Mm-hmm. Right. Well, and I know that you always take healthcare into account when you're talking about somebody's retirement plan. So Winston, if somebody would like to sit down, make sure that they are well prepared for these costs in their retirement, what's the best way to reach you?
Well, you can get us on the telephone at area code 602-456-1928. That's 602-456-1928. Or go online and visit us at winstonandcompanies.com, where you can click on our calendar and schedule yourself a 15-minute complimentary consultation.
Okay. Winston, thank you.
Thanks so much, Erin.
Got a plan for your retirement, 'cause you know it's just down the road. But if you don't know where to begin, better ask Win.